Hi, I'm Rachel Marino, the Clinic Director for Marino Health and Wellness right here in Londonderry, New Hampshire. And I just wanted to give you a brief little summary of our new program that we have for anyone with arthritis of the knee. So we are really excited because we've been treating knee pain for years now on a cash pay basis. Our regenerative medicine injections are not covered by insurance. And even though, they've worked very well, not everybody can afford those procedures. So to be able to extend our services further, we're now accepting Medicare and most private insurers for this knee pain protocol. So if you've been diagnosed with arthritis of the knee, one knee, both knees, doesn't matter, we can definitely help you. So the way it works is you come in first for your free consultation. It's a no obligation consultation. It's basically like a discovery appointment. We find out your history, what you've tried in the past, what's worked, what hasn't worked. Obviously, you're seeking us out for a reason. Most people are trying to avoid a knee replacement surgery, and that's our goal, is to get you to feeling better, to get more range of motion, less pain, back to doing the activities that you love to do without having to go through a surgery, which comes with a long recovery period and pain during that time period. Our injections in the office, you walk in, you walk out about 30 to 45 minutes later, and you go right back to your life. So the new injections that we're offering that are covered, it's a gel or hyaluronic acid injection into the knee. And some of you hear that and you say, I've had that before, I've tried Synvisc, or there's multiple different kinds. The difference is that this is an exact program that we're following, and this program has a 90% success rate if you follow it each step along the way. The product that we use is called Genvisc. It is a completely natural, they call it a visco supplementation. So basically we're trying to cushion the joint. You have fluid in your joint. When you're young, you have really nice cushioning in there. As we age, we wear it down. If you think about a car, an engine that's running for a while, you need to replace the oil because otherwise you're going to age it faster. So we're kind of talking about replacing your oil here, except it's in your knees. So the gel that we inject, completely natural. It's not from any avian sources. Some of the other ones, you can't use them if you have an allergy to feathers or chickens or eggs, things like that, but this is completely natural. Our body makes hyaluronic acid anyway. What we're doing is basically concentrating that right into the joint capsule. What gives us the great success is not only a superior product that we're using, but also our equipment. So this is an X-ray fluoroscopy machine, so we're able to take still X-rays when you come in, which we'll normally do at the consultation. We'll review that with you and let you know the level of arthritis, one knee versus the other knee, make sure that you're a good candidate for the program before we move forward. And then the next step is actually using the fluoroscopy guided, which is basically an in-motion X-ray. We're going to guide the needle right into the spot that we want to inject, and we see it on camera. So that takes away any error. It's been reported that 1 out of every 4 knee injections done blindly, so done without this guidance, that it's actually not in the correct position. So it's not going to do you any good if you inject a substance and it's not in that joint capsule. So with this, we're making sure that we are 100% in that joint capsule. We also do a test with a contrast dye before we do anything to make sure that there's no leak in that joint capsule. If any of that is leaking out, then you're not going to do yourself any favors injecting a gel in there. It's just going to leak itself right out of that space. So we make sure that everything is intact, that you're a good candidate, that you fit the criteria, and then obviously we check insurance coverage to make sure that we can tell you how this is going to work for you. So it is a series of 5 injections. So you'll come in every week for 5 injections, and then part of the protocol is also an unloading knee brace. That's part of what gives us more success with this program. That's what brings us up to that 90% success mark. It's going to either unload your knee medially, the inside, or laterally, the outside. Everybody wears down their knees a little bit different. For example, this one, we're looking at the medial, the inside, and then the lateral, the outside. So this person has some decreased space medially, so the way we'll fit the brace is we'll be kind of trying to shift things a little bit and unload the pressure over here so that the substance we inject can actually spread throughout the joint. And then we have you wear the brace for a few hours after your procedure. And then if you're at home and you're standing for a while, or if you're going to be walking around a mall, something like that, you're going to put the brace back on. So even just the bracing alone, people have felt better because we're shifting how this looks inside your body. So anyway, that kind of gives you a little summary. Obviously, we go over much more when you come in for your consultation, but we are really, really excited to be doing this and to be offering it, and so far it's been going very, very well. So again, it's for knee arthritis, and give us a call if you want to come in for that no obligation, no cost consultation. It's 603-336-2011, and we look forward to seeing you.